Now let's go over spinal cord injuries, okay? Now usually spinal cord injuries is divided into traumatic or non-traumatic, right? And usually the assessment findings and treatment are based on the extent and level of the injury. And when, as a nurse, the interventions we divide it into either if it's acute emergency management or a chronic chronic management, okay? So for example, a patient with an acute spinal injury, right? So there will be a spinal shock, and symptoms would include an absence of reflexes below the injury. There'll be some flaccid paralysis. There would be some urine retention, so there'll be a distension of the bladder, right? Patient would have a hypotension and would be bradycardic, okay? Main interventions for that would include, remember, airway, breathing, circulation. ABC is always the first one. Next is we're gonna immobilize the client to prevent further injury, and then we're gonna have to prevent complications of the immobility, okay? Now, we all know what the complications of immobility are, right? Obviously skin breakdown, right? So turn positioning of the client every 2 to 3 hours is very important. Also constipation, so therefore we do need to increase fiber and fluids in the client's diet, unless it is contraindicated, okay? Also, a big problem too is the formation of a deep vein thrombosis, which is life-threatening, right? It's a big complication of immobility. So usually the client might be on low dose heparin therapy, or we do need to give the client an anti-embolic stocking, okay? Now let's go over multiple sclerosis, which is basically a progressive CNS disorder caused by demyelination in the brain and spinal cord, right? And we all know that the symptoms vary with the location of the demyelination, okay? Now, main 3 categories of meds that you will most likely encounter in your NCLEX exam for our patient with multiple sclerosis would be glucocorticoids, immunosuppressants, and baclofen, which is a muscle relaxant, okay? Now, let's go over baclofen. Now, baclofen just basically helps relax the muscles, and side effects that we do need to watch out for includes drowsiness, dizziness, headache, and constipation, okay? Now, with glucocorticoids, we can either give our patient prednisone, corticotropin, which is ACTH, and dexamethasone, okay? Now, take note that with prednisone, it can make the blood sugar rise as a side effect, right? And this can cause or worsen a patient with diabetes, so we need to watch out for that. Also, side effects for prednisone can include nausea and vomiting, edema, and weight gain, okay? Now, let's go over immunosuppressants. Now, usually the 2 most common meds would include cyclophosphamide, which is cytosan, and interferon beta 1b, okay? Okay, let's go over myasthenia gravis, okay? Now, myasthenia gravis is basically an autoimmune disorder, right? So, what's going on is that the body is fighting itself, right? It's causing disturbances in the transmission of the impulses from the nerves to the muscles, resulting in extreme muscle weakness, right? It's a progressive neuromuscular disorder. There's also a decrease in the acetylcholine levels, which is basically almost like opposite of Parkinson's disease, right? And all of this in turn causes the weakness in the skeletal muscles, okay? Now, we have 3 main drug categories for our patient. First of all, let's talk about, we all know, diagnosing of myasthenia gravis. We use the Tensilon test. Basically, we're trying to differentiate cholinergic crisis from myasthenic crisis, okay? And remember, the indrophonium or neostigmine can cause a quick relief of muscle weakness, okay? And atropine is the antidote for a cholinergic crisis, okay? Now, main drug therapy would include glucocorticoids, anticholinesterase inhibitors, and immunosuppressants, okay? Now, let's go over anticholinesterase drugs. And what it does is basically it destroys the acetylcholinesterase that breaks down ACH, okay? And ACH is the one that helps with muscle contraction, right? And A couple of the most important acetylcholinesterase inhibitors that you might encounter in your NCLEX exam is neostigmine, which is prostigmine, and pyridostigmine, which is mestinon. Okay. Another category is glucocorticoids. Main drugs would include prednisone, dexamethasone, and corticotropin, which is ACTH. Okay. Now, lastly, you can also use immunosuppressants such as cyclophosphamide, which is cytosan, and cytosan is actually a chemotherapy drug, and side effects can include nausea, vomiting, loss of appetite, and diarrhea. Okay.